I'm Lisa White. I'm the Director of Home Care, Hospice, and Palliative Care for Munson Home Health. And Munson Home Care is a division of Munson Healthcare. We cover 23 counties in the state of Michigan. When we first brought Vivify on to Munson Home Care as our partner for telehealth, we weren't quite sure how it was going to go. And I was a little leery, in fact. I will tell you, a lot of the information that's out there about telehealth products and how great they are created from the telehealth organizations themselves. So I was a little apprehensive, but this has been proven to be so effective for us that we are ready to expand and add on. We're very confident that this is where we need to be headed, and we're going to be adding and in fact doubling the units that we have. Our focus was our COPD and our CHF population, hoping that we could have an impact on reducing our readmission rate. We were running somewhere around 12.5% for a readmission rate for our COPD and CHF population, and we are able to get that down to 4%. So we were really impressed. At first, the first couple of months, we thought, well, is this a fluke? But the results kept coming in as real positive. Anybody that we have had on telehealth monitoring has ended up being a great impact in reducing our readmission rate. I have an example, in fact, that just recently happened. It's not one of those that actually stopped the readmission from happening, but it may have potentially saved this patient's life. Our registered nurse coordinator in the office, in our Cadillac office, had noticed that one of her patients, their SpO2 had decreased significantly. So she called that patient, and the patient sounded very out of breath, very winded, maybe a little bit confused, and she said to her, "Let me call your nurse. I want to see where she's at. I'd like her to come and see you." So she hung up the phone, contacted the nurse, called the patient back. The patient did not answer the phone. So we called the Osceola County Sheriff's Department to go do a well check on this patient. They went there, and the patient was very confused and dizzy, was found to be hypoglycemic, and was actually having a heart attack. So they called 911. It was one of those instances where, what if we hadn't been checking on this patient? Would it have been too late for her?